Hi, my name is Raul Vargas. I'm going to talk about hair and lung transplant from HCV-infected donors to uninfected recipients. First, we have the definition. A surgical procedure in which tissue or an organ is transferred from one area of the body to another or from one person, the donor, to another person, the recipient.
Every year, many thousands of people receive the gift of life, a life-saving transplant of a heart, kidney, liver, lungs, pancreas, or intestines. And thousands more people receive corneas and other tissues that restore sight and health. Transplantation is one of the great medical advances of our time. How does it work? It all starts when someone's organ begins to fail, and that person will need a transplant to survive. A thorough evaluation is conducted at a transplant center, and if the person's a good candidate for a transplant, he or she will be put on the National Transplant Waiting List. Once a person is on the list, the wait for an organ begins. A national system matches people on the waiting list with donors. The factors considered in matching donors and recipients include blood type and body size, how sick the patient is, distance from the donor, tissue type, and length of time on the waiting list. What doesn't get taken into account? Organs are never matched based on race or gender. Income, celebrity, and social status are also never considered in matching donor organs to waiting patients. There's no telling how long the wait will take. In fact, some people don't receive an organ in time because the waiting list is very long and there aren't enough donors available. That's why an average of 20 people on the waiting list die each day. Imagine how many we could save if we all were donors. Most organs for transplants come from deceased donors. Here's how that happens. A person comes to the hospital with a life-threatening brain injury, such as from an accident, a stroke, or lack of oxygen. The doctors work hard to save the patient's life, but sometimes nothing can be done. There's a complete, irreversible loss of brain function. The patient is clinically and legally dead. That's when being a donor can turn a time of loss into a time of hope. Because machines have kept blood containing oxygen flowing to the organs, they can be passed along. One person can give life to as many as 8 people through organ donation and enhance the lives of 50 people or more through eye and tissue donation. But now, minutes matter. Matches must be found, and transplants must happen quickly. The hospital contacts an organ procurement organization, an OPO. OPOs manage the organ recovery process. The OPO checks the state organ donor registry. If the person is already registered as a donor, they'll inform the family. If not, they'll ask the family to authorize donation. A medical examination takes place. They check the medical and social history, and if the person is eligible to be an organ donor, the computer begins the search on the national waiting list for well-matched patients. The best matched patients for each organ are contacted by their transplant teams. This is the call that every single person on the waiting list has been hoping for. The call that could mean a second chance at life. Now the transplant happens. A surgical team recovers the organs, then corneas and other tissues. The organs are sent to the transplant hospitals where the patients and transplant teams are waiting, and the life-saving transplants take place. It will take healthy living and medications to keep the organ working well in its new home. But some wonderful person has given the most precious gift of all, the gift of life. You too can make the decision today to sign up on your state registry as an organ, eye, and tissue donor. Any age is the right age, young or old. And any day is the right day to sign up as a donor. You can register through your driver's license office, or you can sign up right now, online. Remember to tell your family so they can support your wishes. More than 145 million people have already signed up, but we're all needed to save more lives. Go to organdonor.gov and sign up in your state donor registry as an organ, eye, and tissue donor. Go to organdonor.gov and share the gift of life.
Applications in medicine. Hearts and lungs from donors with hepatitis C viremia are typically not transplanted. The advent of direct-acting antiviral agents to treat hepatitis C virus infection has raised the possibility of substantially increasing the donor organ pool by enabling the transplantation of hearts and lungs from HCV-infected donors into recipients who do not have HCV infection.
You'd never know that 3 years ago, Connor Sullivan was in organ failure. A virus attacked the Air Force veteran's heart, and he needed a heart transplant.
Being on the transplant list, it's a constant worry in your mind of when you're going to get the call, if you're going to get the call.
About 1,000 patients die every year waiting for heart or lung transplants because there aren't enough organs available. Then doctors at Brigham and Women's Hospital told Connor about research they were doing involving organs infected with the hepatitis C virus.
Decided that was a good idea. It would allow me to get a heart quicker.
A new study shows researchers have been able to prevent transmission of the virus by treating heart and lung transplant patients with antiviral medications.
We started treatment of these patients as soon as it was safe to do so, within few hours after transplant.
Dr. Ann Woolley says the study of 35 patients had a 100% success rate.
They had cleared their virus, the majority of the patients, within a few days, all by around the 2-week mark. And we saw no difference in outcomes in our hepatitis C group compared to our non-hepatitis C group.
After 18 months of waiting, Connor finally got his new heart. The 25-year-old is now training to run the Boston Marathon.
It means a lot to me. I think I have a lot of people to thank, and this will kind of be for them.
Dr. Malika Marshall, CBS News, Boston.
Pros and cons. The pros: with this we increase the possibility of helping patients of the waiting list who urgently need a transplant. The cons: more cases of acute cellular rejection for which treatment was indicated occurred in the HCV-infected lung transplant recipients than in a cohort of patients who received lung transplants from donors who did not have the HCV infection. Issue applying in Ecuador. The article did not mention Ecuador, and looking for information seems that this type of transplant has not been practiced, but it would benefit us since the transplant area is a deserted area in a matter of intention due to lack of information to citizens. This type of information would help to break taboos and give a chance of life to those who need it without excuse.
Right now, as many as 4,000 people in the United States are waiting for a heart or full heart and lung transplant, and more than 25% of them will die before they can get a donor organ. So some of the top transplantation programs in the country are now addressing the shortage by accepting hearts from donors who had active hepatitis C. Recipients know they'll get the disease, but so far, they've all been cured. Carrie Hayes has had a faulty aortic valve since he was born.
I wasn't getting the oxygen that I was supposed to get. It would blood would flow back and forth instead of all one direction.
He got an artificial heart a year and a half ago, which is almost as long as he was on the list for a donor heart. His doctor finally found Carrie a heart from a donor who had Hep C. It could be cured with antiretrovirals after surgery. Carrie got his heart and just found out his Hep C is gone.
I felt that I was probably going to be cured, but it feels good to have somebody tell you, yes, you're officially cured.
Transplant surgeon Jorge Reyes says 20 livers and hearts from donors with circulating hepatitis C have gone to patients so far.
They're Hep C negative. They have never been exposed to hepatitis C. but their risk of dying of their liver disease or their heart disease, etc., is very high.
12 patients have been cured of Hep C, 7 are still getting treatment, and 1 died of transplant complications. No potential recipient has said no.
If we have a donor who is hepatitis C positive and with healthy organs, all those organs should be used.
Kerry is still taking a lot of anti-rejection medication, but he's delighted to get back to his normal life with Rena and his family.
All signs are pointing to getting back to being like everybody else.
Conclusion. In patients without HCV infection who receive a heart lung transplant from donors with hepatitis C viremia, treatment with an antiviral regimen for 4 weeks initiated within a few hours after transplantation prevented the establishment of HCV infection. Thank you.